Hello, everyone. Welcome to Faculty Spotlights for the College of Professional Psychology at the Chicago School. Today, we are joined by Dr. David Sitzer. Dr. Sitzer is the Department Chair for a Clinical Psychology Program in Los Angeles. Welcome, Dr. Sitzer.
Thank you, Dr. Garrison.
Tell us a little bit about what inspired you to pursue the profession of clinical psychology.
Well, it's actually my journey was not really a direct journey. I actually started off as an engineering major when I went to college, and kind of always come from a long line of engineers and always wanted to be an engineer.
Yeah.
So when I got to college, I started taking all of my engineering classes and was very young. Actually went to school a little bit early and probably wasn't so prepared for living away from home. And could have done better in engineering. And so a couple of years in, I took my first general ed class. It happened to be a psychology class, the Psychology 101 class. And I remember sitting in that class, and I have a clear memory of sitting halfway back in those little desks with the little armrest. And the instructor, I think, was talking about IRB that day and the need for an IRB. But for some reason, something clicked on that day. And I said, you know what? I think I want to be a psychologist. I had generally been sort of the person that people go to for advice, or the person that people could open up to, a good listener. And I decided, I think I'm going to be a psychologist. And then my next thought was, nuts. That means I got to go get a doctorate. Okay,
Yeah.
I'm going to go get a doctorate. And so I worked hard and went to a master's program, and then got into a doctoral program, and really kind of got in wanting to study trauma and PTSD, and went to my doc program specifically to go study that. And when I got there and took my first cognitive assessment class, the instructor, which I think is rare for instructors, got through the syllabus early and started talking about some neuropsych tests. And that just really got my attention. I really loved how much information we could get about someone in such a short period of time with some testing. And so I switched my focus from trauma over to neuropsychology, and then kind of pursued that kind of ever since. It was just sort of this being exposed to new things and really enjoying all of the aspects of psychology. I was participating in most of the labs on campus and kind of being productive and presenting until, I guess, internship came up, and my training director called me into his office and said, you really need to pick something that you're going to go focus on. You really need to focus.
Yeah.
And so I picked neuropsychology and adult neuropsychology. That's kind of how it came to be.
So I got to make sure I heard you correctly. It was a lecture on the Institutional Review Board in general psychology that started your interest in the field. That's kind of unusual.
It was some of the ridiculous and sometimes unethical things that people had done.
Yeah.
Not that I was looking to do those, but just sort of the recognition of we could study people and learn about how people work.
Yeah.
Coming from a place where I was figuring out how machines work and how to make machines work better, could make people maybe work better or help people.
Yeah. There's a natural bridge there somewhere, right?
There's a really vague natural bridge there.
Yeah. Tell us a little bit about what you enjoy most when it comes to teaching and working with students.
So what really sort of keeps me teaching and what keeps me engaged and really makes me enjoy it is this idea that I'm helping someone understand something they didn't previously understand, or helping them learn a skill or develop an ability that will advance them and sort of give them a little bit better life. So I really enjoy helping people develop new skills. I really get a real good feeling when I watch someone get it, and then to watch them either teach someone else or talk about how they applied what they learned in a clinical situation just really makes me feel good, makes me feel proud. And I really like having something to do with other people succeeding.
Yeah, being a part of their growth is a
Yeah,
driver.
I think that's a good summary. Yeah.
Yeah. Tell us, as you think about the students in your program, what's one skill or one lesson that you hope they take away from their time in your program?
One thing I hope they take away is, as I'm thinking back on actually a lecture I just gave, um, really two things. One is the importance of context. The context is critical, that
Hmm.
whatever information you have needs to be placed in the broader
Yeah.
cultural, relational context of what's going on in their life, how they grew up, what have been influences and what has influenced a person's life. So context is critical, and um, really the other thing is understanding why, having an understanding of the why or the reason. I
Yeah.
never let a student get away with just giving me an answer. I ask a lot of questions during class, and students will give me answers. And about a third of the way through, they learn that I'm not going to let them stop with just the answer. My next question
Hmm.
would be, why do you think that?
Yeah.
So think critically about things, have a reason why you're doing things. Why do you think something? Which means kind of going beyond the fluff and beyond the surface level and thinking about why you're
Yeah.
treating your patient the way you're treating them, or why you're making the decision you're making, or why you believe what it is you believe.
Yeah, those considering those contextual variables and going deeper than just the first why, right? Getting three, four, or five whys down is a really important skill to take away.
Yeah, I think that's important to understanding your clients or patients, and I think that's important to kind of being your true self, is
Yeah.
understanding why you're doing things.
So there are a lot of people interested in the field of clinical psychology. Some of them are more interested in actually going into the field and becoming clinical psychologists. What's a piece of advice you would have for someone who's looking to enter the field?
As someone was entering the field, I might tell them a couple of things. Um, Never stop learning. Pay
Hmm.
attention to everything that's going on around you, especially pay attention to the things that we didn't teach you here. We do a good job, we do a great job of teaching people psychology and clinical psychology and related topics, and teaching people about professionalism and being a professional. We focus on those kinds of things and being culturally aware and culturally sensitive and culturally humble.
Yeah.
But there's so much more to developing a career. And so those are things that we don't teach a lot of in graduate school simply because we want to limit it to 5 years.
Right.
So there, learn from your peers, learn from your supervisors, learn from your colleagues, learn from everybody around you about how to be successful in what it is that you're doing. And you can use the knowledge, the clinical psychology skill and knowledge, and apply it all over the place. You can apply it in your relationships. You can apply it to your personal relationships, negotiating for a salary at work. You can use
Hmm.
it um, really to develop all sorts of networks, to
Yeah.
understand friends better.
Yeah. Yeah. A couple things come to mind for me as you say that. Um, the idea of consultation, right? Consult, consult, consult. That's one of the mantras of clinical psychologists. Ask a lot of questions, work with your peers,
Yeah.
get get that consultation, ask a lot of good questions. And then the other is, and I've shared this a lot with incoming students into clinical psychology, is this idea that, at least from my perspective, that going through a clinical psychology doctoral program and entering the field will do more to change the lenses through which you view the world than almost any other degree I can think of. And it does, it's so broadly applicable when you learn those kind of foundational skills and develop them over time. It does change the way you see yourself, your interpersonal relationships, your relationship to the profession and to work and to negotiation and all of those things. So there's a there's a lot of value in that, I think.
Yeah, I agree. It's a good way to say it.
So there are a lot of options for people who are interested in going to a doctoral program in clinical psychology. Why, from your perspective, do you think the Chicago School is a great choice?
Probably a few reasons. Um, and for me, it really comes down to the faculty
Mhm.
and the faculty's relationship with each other and with the student. I know our faculty really care about students, and what we talk about a lot in our meetings is how do we best prepare students for to become professionals? How we focus a lot on how we can train our students to be outstanding psychologists once they leave us. We take a lot of pride in hearing about how well our students are doing or our alumni are doing.
Mhm.
Um, and so we focus on, we're always trying to find better ways to teach. And we're focusing on developing activities that promote sort of learning and learning relevant information and staying current.
Yeah.
Um, and I think our training programs also focus on giving students real world opportunities. And so I know in my program, we provide a lot of opportunity to interact with the community. We provide services to the community. We give opportunities for students to apply what they're learning in the class to the general community.
Yeah.
And I think that's a strength of the Chicago school kind of model.
Definitely. Well, Dr. Sitzer, I really appreciate you joining us today. And again, thank you for being a part of this.
Thank you for the opportunity. It was a pleasure.